Alright, now I'm going to prep her for her surgery, now that she's been intubated, and I'm going to prep from her xiphoid process, just at her rib cage, all the way down to her pubis, and then out about 3 finger lengths from each side of the surgical site. Which for me is actually probably 4 to 5 fingers, because my hands are smaller than most people's. Now that I've got that done, I'm just going to get all the hair off, make sure I've got her shaved really well, and then I will touch up any parts that need to be touched up. Vacuuming off the hair, I took off my gloves because they were sticking. I'm just seeing if I need to shave any other areas. Look at that. And now that I vacuumed her up, I can see that I've left a little bit of hair, and I can clean that up before we go in. Your hair growing. Okay, now we're going to start our scrub after I do one more quick vacuum to get any excess hair off. I'm going to switch out my gloves. Now I'm going to start with the scrub, and first initial scrub, I'm just going to get any excess dirt and hair off. The doctor saw that she has a little bit of a skin infection, so we're going to make sure we send her home with some good antibiotics. Get some of this excess hair off.
I didn't like food anything.
I'm going to do one more just because I got a little dirt off that last one. And then I'll clean up with solution.
Okay, Shannon and I are going to demonstrate CPR on our CPR trainer dog here. We've got it intubated and attached to oxygen. And to perform CPR, you compress the chest 100 to 120 times per minute, about 1/3 to 1/2 over the heart. And Shannon over there would, as I'm compressing, we'll do about 10 breaths per minute. And then after about 2 minutes, we would switch, because that's probably when we'd be getting tired and need help. And then while we're doing this, hopefully we have a third hand of somebody that could be pulling up our CPR drugs and administering. Okay, next Shannon and I are going to demonstrate doing CPR with a ambu bag. This ambu bag has a dial here so you can see the pressure. And since this is a smaller dog, we don't want to go too far above 15. So as she's doing compressions, I'm going to be doing the breaths. And that's how that works. Oh, and this is connected to the oxygen to our machine.
For her over surgery. Make sure her head is always stable and that she's not attached to anything. What? All of the equipment is already set up. Hook her back up. her positioned on the table. Need to be tightened. She is tied down and good to go. So this first machine is the pulse oximeter. Then we've got our blood pressure machine. And then we have our Doppler and our attachment for our pressure cuff and a portable ECG. And this is the oscillometric blood pressure monitor that we connect to our patients when they're in surgery. That is the monitor screen. Unfortunately, I do not have a computer to show how this one works, and I don't have one for my ECG because it is being
Okay, next I'm just going to show how to use a blood pressure cuff monitor. And this one, it's measuring now, is filling the cup, as you can see on her ankle. Let's see if this newer cuff works. I was having issues with the older cuff. And this measures the systolic, dystolic, which are the mean and the map of the heart rate. Let's see if this works. So the cuff that you want to pick is 30 to 50% circumference of the limb. The part that measures the blood pressure goes over the peripheral artery of the limb. Let's see if this wants to work for us. At the moment it's measuring. And this one is set to measure every 2 minutes. All right, and there you go. It's giving us the heart rate of 68 beats per minute, systole at 52, distal at 38, and the map at 43. And then it'll tell you when it's going to read the next heart rate, and you just keep doing that until you get the results that you're looking for, or you're done with the patient. Next, I'm going to attempt to demonstrate how to use the Doppler, which is also used with a blood pressure cuff and the sphygmometer. You can kind of figure out, where the blood pressure is. Once you've turned it on, you pumped this up, and then you can slowly release, and as you release and you start to hear the heartbeat again is where the blood pressure is at. And then wherever the blood pressure gauge hits, that is, you'll write that down 3 times, and that'll be your mean of how their blood pressure is. Release that while I'm doing that. So the Doppler, dog hair, gets placed on the ventral surface of the paw over the artery. And you use some ultrasonic gel and shave the area. Stay. Lay down. Good girl. You're not in trouble. So I am going to place this on her ankle here and hold her paw. And I'm going to turn down the volume just so it doesn't scare us as we turn it on. And then we listen for the pulse. And typically tape it down. So there we go, we can hear her heartbeat. So now I'm going to pump up the blood pressure cuff. So I've got it pumped up. As it falls, it's about 62. And we release it. Give it a second and try it again. So now we can hear it. And I'll pump the cuff back up. And as it falls, and we can hear it again at about 83. And we just continue doing that until we get a mean number for her pulse. I'll go ahead and turn this off now that she's good. Okay, the next thing I'm going to show is an example of how to use the ECG, which is the electrocardiograph. What the electrocardiograph is, it reads any underlying patient heart rhythm, like such as arrhythmias. It reads asystole, which is a flat line. It also reads ventricular fibrillation and pulseless electrical activity. So this is very useful before any surgical anesthetic procedures or after any procedures, just to kind of monitor the dog after some big surgery such as a GDV. And so what this does is this plugs in to the line, and since this is wireless, it would go to a computer. I'd show you how it would work on the computer, but unfortunately the computer is out of commission for the night. It got sent away to be worked on. So I have placed the leads on Pixie here, and the colors typically go snow over trees or smoke over fire. So the red and the green go on the bottom and the white goes on the top, and these little leads just go in around the ankles and are tightened and then dampened with a little bit of alcohol, and then it'll read and send all the information to the computer so that you can watch for any changes in the heart rate, which is the QRS. Okay, the first thing I'm going to show is how to use a pulse oximeter. And what the pulse oximeter does is it estimates the saturation of hemoglobin through this little probe here. I can't see if you can see the little red light on this side. So that goes to the inside of the most blood vessel rich area. You can place it on the lip, on the tongue. Lay down. Pixie, lay down. I know you don't like sounds. You can place it on the tongue, lip, ear, prepuce, or between the toe webbing. I'm going to show this, if she'll hold still for me, on her lip. You just connect it to the lip. I'm just going to hold on to it there because it's fallen over a little bit. It usually takes a couple seconds to read. and it's set to have an alarm go off if it measures low numbers. If it's below 95%, that is. So the probe itself is sensitive to absorption of light by hemoglobin and the pulses in the small arteries. Hold still, baby. Hold still. Good girl. Good girl, hold still. Which it might not read on her, because she's pretty wiggly. It also has a little piece that can be attached to the respiratory monitor for the anesthetic machine, and it'll give you the respiration rate. Nope, it's thinking about working. So right now it is trying to read her pulse rate. I don't know if that can be seen on there. It's yelling at me. Try one more time on that spot. If it doesn't work, you can always move it to the ear, the toe webbing. Give it a couple more seconds. The tail's going. Good girl. Stay. Oop. Just make sure it's not slipping down. So unfortunately it's not going to read on her, but that is how you would use it. And anything below 95% should be looked into to see why the animal isn't getting enough oxygen and hemoglobin in the blood. So I'm just going to take that off.
I guess I should show that it's actually you.
It's me. With glasses now. Now I can see what I'm doing. Not squinting.
You're a bastard, you know that? Is it hot in here?
Mm-hmm.
Yes. I'm such an asshole. Give me my testicle.